Auditory neuropathy spectrum disorder represent a range of hearing disorders where the transmission of sound from the inner ear to the brain is disrupted. Anything between the inner ear cell to the brain, anything can be affected, but outer ear cells are normal in auditory neuropathy spectrum disorder. Two tests are important in ANSD. First is OAE, second is ABR. In OAE, there is normal response showing outer ear cells are functioning normal, while in ABR showing there is absent or abnormal response in ABR, that is suggestive of ANSD. Pathophysiology. ANSD affect the auditory nerve fibers or the synapse between the inner ear cells and auditory nerve. These result in impaired neural synchrony, leading to difficulty in processing sound. It means anything between the inner ear cell to the brain, any pathway can be affected. The issue may lie in inner ear cells, the synaptic junction between the inner ear cells and auditory nerve, or the auditory nerve itself. It may be desynchrony or auditory nerve pathway defect in ANSD. Etiology. It may be genetic, congenital, or acquired causes. Genetic causes are mutation in genes such as OTOF, PJVK, DIAPH3 gene. It may be neonatal factor like premature birth, hypoxia, hyperbilirubinemia, or ototoxic drugs. It may be neurological disorder including such as Charcot-Marie-Tooth disease, Friedreich's ataxia, and other neuropathy can be associated with ANSD. Clinical features. Hearing impairment ranges from mild to profound hearing loss and can fluctuate according to the thresholds. Speech perception disproportionately poor compared to degree of hearing loss. Absent or abnormal acoustic reflex or present autoacoustic emissions will be there because of outer ear cells are normally functioning, while ABR is abnormal or absent. Diagnosis. Autoacoustic emissions is present, outer ear cells are normal. Auditory brainstem response often absent or abnormal. Middle ear acoustic reflex is typically elevated or absent. Or behavioral audiometry, there is disproportionate hearing loss in ANSD. Management. Hearing aids often have limited success because of poor neural synchrony. Amplification may be helpful. Cochlear implants can be beneficial for some patients, especially those with significant difficulty in speech perception. However, outcomes are variable. Assistive listening devices. Frequency modulation systems may help in noisy environments. Auditory verbal therapy focused on enhancing listening skills and improving speech perception. Regular monitoring. Hearing loss in ANSD can fluctuate, so ongoing audiological assessment is crucial. Prognosis highly variable, depends on the site and extent of neural dysfunction. Early intervention can improve outcomes, but challenges with speech perception often persist. In conclusion, ANSD is complex auditory disorder requiring a comprehensive approach to diagnosis and management. Collaboration among audiologists, speech language pathologists, and medical professionals is essential to optimize care of the individual with ANSD.